My name is I'm Dr. Anne Kamau, and I work for the Institute for Development Studies, University of Nairobi in Kenya.
I wanted to just talk a little with you today, a little bit about the work you're doing. Can you tell us a little bit more about your research?
This research, we are focusing on children's safety, and we want to find out what really determines child safety within the urban spaces. How are children planned for within the urban spaces? How do children move, and what are the mobility needs? So that then the main question that you're going to ask, does the planning align to the needs, the mobility needs of children? Do we even understand where children travel to? Because I think the assumption normally is that children travel just to school and are often accompanied by their parents, but that maybe is not always the case. Maybe sometimes children travel on their own. So if we're able to determine what are the mobility needs of children, then we ask them what mobility options are available. Do they travel by school buses? A lot of that happens in Kenya, but in Kumasi it's different. Do they travel by public transport? And if yes, what kind of public transport? Do they travel by walking? They just walk to school? Or do they use, for example, is very common now in Kenya and in Ghana, using motorcycles. Beyond that, then we raise the question, who really determines how children move? Their parents, their caregivers, and at the back of those to determine how children move is the issue of safety ever at the back of their mind? Does that come as a first priority? That how my child moves to school, to the religious places of worship, to the markets, to even see their friends, is safety a primary concern? And then once we do that, then we look at then what are the safety records in terms of children mobility. We're looking at what are the accident rates affecting children, and is there anything that's being done in terms of planning to just enhance children's safety as they travel? So that's really the gist of our study.
When you think about reopening Nairobi, how do we keep children safe in these large cities like Nairobi and Kumasi in Ghana, given the pandemic?
With or without the pandemic, children's safety should be a priority. Unfortunately, that seems not to be the case in most instances. Fortunately for Kenya, we have a national school safety policy, which is regulated by the government. For instance, for children using school buses, all school buses are supposed to be painted in yellow, and they should have the name of the school clearly marked on the side of the vehicle in black and in big print. And then they are supposed to operate only 6 to 6 p.m., 6 a.m. to 6 p.m. So beyond 6 p.m., no school vehicle should be on the road. However, while that happens within the school buses, it does not really apply in cases where children use alternative public transport means, or whether when they walk to school, or even how they are transported in private vehicles, or even when they have to use a motorcycle, how children get to school. So we find sometimes it's overloading. On motorcycles, you find even 3-4 children on one motorcycle being ferried to school. Children who have to use public transport, some of them really struggle because Kenya, we don't have a national public transport system. We use the paratransit largely, or what you call the matatus. And sometimes children are even refused, denied access into these vehicles. And some vehicles outrightly say we are not a school bus. So it's a struggle. So I would say, first and foremost, with or without COVID-19, children need to be able to travel safely to school, especially when they are many times not accompanied, they're not using a school bus. And also, we also need to ensure that areas where children are crossing are also safe. Often, children are among the pedestrians who are killed. It is estimated like 1 out of 10 people would either be a child or a teenager who gets killed on the road, on the Kenyan roads. So, and Kenya is categorized as one of the countries with high fatalities, low fatalities, 15 15th in the world, but we don't have very good documentation in terms of children's safety in the country.
Yeah.
So this is one area we hope, of course, we may not be able to cover all of this within this 1 year initial phase,
Sure.
but this is one area we wish that we're able to continuously document as a country, as an institute and a university, working with partners to really even be able to determine how many children are killed and also identify which are the hotspots where children are killed so that then maybe there can be interventions to enhance children's safety.
How has COVID-19 changed the definition of safety for children in transportation right now?
Well, I think the real definition of safety in the context of COVID-19 is just locking up children. Children are just locked up. In Kenya, mobility for children has totally been restricted or minimized to really what is considered as real essential travel. And we are getting government reminders, which I think on safety, that please keep children at home. Children are sent home from school. Those were in boarding schools and schools were closed. So we don't have children now going to school. So there's a lot of e-learning, online platforms. But basically it means, especially in the urban areas, that children are no longer free to move in the context of COVID-19. And you can imagine what that means to children's psychology and well-being. So perhaps that constriction just means a lot to them. So mobility is important also for the health of children.
Yeah.
But in the context of COVID-19, they just have to stay at home.